These pictures make me sad.
Natalie Cobbing admires photos of her daughter, Brittany.
Beautiful big blue eyes.
Brittany Cobbing died from an overdose on June 6, 2015.
My daughter personally overdosed from fentanyl. I don't think she knew she was doing fentanyl.
Cobbing says Brittany had been using heroin for about 6 months, but had experimented with drugs since she was 19.
I think her problem started when she was growing up. She was overweight and got teased for that.
Losing Brittany haunts her.
That's how I wake up every morning. That realization my daughter's not here anymore.
The coroner's report shows Brittany had 7.2 nanograms of fentanyl in her system when she died. Fentanyl-related fatalities in Ontario have spiked in the last 5 years. In 2015, the drug was found in almost 200 opioid-related deaths. 2 near-fatal overdoses within 1 hour are linked to this house in Cambridge. That same day, Brantford police report 4 opioid overdoses in just 2 hours.
Maybe 2 years ago, it was 1 opioid overdose a week, maybe. Probably not even that much. To go to 1 a day is alarming. To go to 4 a day is really alarming.
The government has made a number of changes this year, including making naloxone, the overdose antidote drug, available for free at pharmacies. But these changes came too late to save Brittany Cobbing. Natalie Cobbing says her daughter was so much more than a drug addict. Brittany Cobbing had a daughter of her own, who she lost to foster care.
It was a Christmas present she bought for her daughter. She wrapped it.
Leaving Natalie Cobbing mourning the loss of her daughter and missing her granddaughter.
Yesterday, I went down in my basement to get her clothes and just try to get a sniff of her. But there's no smell on her clothes anymore.
Cobbing now working with other local parents of drug victims.
I want to advocate for these people. They need help, and they're not getting it.
Help her daughter needed, and others are still looking for. An emergency response for a suspected overdose.
We should have seen this coming.
A crisis igniting right across the country and in the province.
Since the year 2000, Ontario has lost more than 7,000 people just to opioid-related overdoses.
Fentanyl is so powerful, it takes so little to really have a lethal effect.
Pharmaceutical fentanyl in patch form is a slow-release pain medication that is prescribed for patients with terminal cancer.
The dose of fentanyl in that patch is going to be the same as the dose of fentanyl in the next patch.
Bootleg fentanyls are often mixed with other drugs, and a fatal dose can be the size of 2 grains of sugar.
It's easy if you accidentally add twice as much. You're still talking about a very little amount of a substance.
As a demonstration, a police officer combines pink and white sugar grains, the pink to represent fentanyl. Once it's spread out and cut, it's obvious the amount of fentanyl is not consistent. This is what makes it so dangerous. Paramedics are now armed with extra naloxone, the antidote to an opioid overdose.
We carry 2 milligrams, we carry 4 milligrams in every ambulance, so we can give much more.
One of the issues with these high-potency fentanyls is that we're not entirely sure whether those overdoses can be reversed by naloxone.
It's dangerous not only to those who overdose, but also to those who respond. This video released by RCMP describes how some officers have gotten sick from just being exposed to fentanyl. RCMP Constable Don Adams inhaled fentanyl while emptying someone's pockets in BC.
It unfolded and basically exploded white powder in my face. So I felt dizzy, I felt nauseous. I couldn't stand up very well.
Constable Rob Dupree felt sick when he was searching a car. He was taken to hospital.
They also did a urine test and all that, and there was trace opiates, and that was just from a 15-minute exposure.
We will treat all powders as potentially dangerous, and right now potentially any powder could contain fentanyl.
The health risk is changing how police approach a drug raid.
Officers are to put on 2 sets of gloves, special gloves, wear a mask, treat any powders that we seize off of the street as potentially dangerous.
It's deeply concerning to watch a predictable and largely preventable crisis unfold before your eyes.
Michael Parkinson says the cost will be high.
Prevention is a far cheaper alternative in the long run than constantly responding to emergencies. But in this crisis, we need to do both.
He used to work at the water towers, and I think that's when it started.
This is Ian Goddard about 4 years ago. Janice Walsh Goddard is still getting used to not having her 25-year-old son around.
I was meant to go first, not him.
Ian Goddard overdosed on May 23, 2016.
I ran around screaming, crying, throwing myself on the floor. I was beside myself.
She knew he was using crystal meth, but when he died, Walsh Goddard was told there was 19 nanograms of fentanyl in his system, and that's what killed him. Illicit drugs laced with fentanyl are being found in the region and are being blamed for a spike in opioid overdoses.
Up to this point, last year we saw about 10 seizures of the drug, but this year we're only able to confirm about 30 seizures of fentanyl.
Fentanyl seizures have tripled locally, and in Ontario, by October 20th, the drug had been seized 609 times, often mixed with others. This is now the second highest number in the country after BC.
It is really a community safety concern.
It's got to stop. It's got to change. I wish somebody had done it earlier so I'd have my Ian here.
Throughout Ian's fight with addiction, his family tried to find support. Walsh Goddard says they kept running into brick walls.
And those brick walls killed my boy.
I think the reason we don't see thousands of parents asking for better policy and programming is precisely because of the stereotype and stigmatization that those folks face.
That stigmatization is what kept Walsh Goddard quiet for so long. She says she felt isolated, had no support, and didn't know where to turn. Then the loss of her son changed her approach.
Ian always said, "Mom, you're the strongest person I know." And he didn't say that once. He said that many times. You feel ashamed. I'm not ashamed of him anymore.
This is pushing her to press for change. Ian was in and out of rehab, a system Walsh Goddard says does not work.
There's too many people that are doing drugs and not enough beds.
She plans to build a support network for parents in the same situation.
I don't want it to happen to anybody else because it hurts. It really hurts when you lose a child.
And advocate for them in memory of her son.